Hello, everyone. Welcome to yet another exciting edition of the Untold, where we share beautiful stories from our beautiful guests. Sain, how are you doing today?
I'm great. How are you, Ahmed?
Pretty good.
Excited?
Today is different,
Very unique.
very unique.
100%.
We're getting into dentistry, the world of dentistry.
Dentistry and doing something for a selfless cause.
Yes, being noble in your missions, in your career,
Yes.
and helping others, not just yourself.
Exactly. I think
know?
we're going to see that the more you give, the more you take.
Yes, and we'll learn more as our guest joins us next. And we're back and we're being joined by our special guest, Dr. Youseef AlAwadhi. Welcome to the show.
Welcome to Untold, Doctor.
Thank you. It's my pleasure being here with you guys, Ahmed and Hussein. And
It's gonna be a beautiful conversation. Let's start with what got you into dentistry. First of all, before we start talking about the profession itself.
So-
what inspired you?
growing up, I fell in love with a dentist that was treating me. He was a older gentleman that graduated from the US. He was a Persian background and he studied in the United States and worked in Kuwait.
Oh,
He
wow.
treated me with kindness. So I fell in love with
Fell in love with your
that-
dentist.
with my dentist, with that specialty. I'm working with people, I'm meeting different people, and at the same time, I'm working with my hand. And I love doing all three.
I find it interesting that you said you fell in love with the dentistry concept when you were younger. I look myself when I was younger. I used to look up at my dentist. I couldn't stand it. It was always a concept that scared me a lot.
You didn't have my dentist.
yeah,
If you
that's-
had the same
that's
guy,
probably-
you would have fell in
It's
love
like when you
with
have
him.
a good math teacher, you end up loving maths. It's just that.
Exactly, yeah.
It's just I'm so interested to know like how could a kid actually fall in love. It's so rare to find a kid.
You know, I truly
dentistry.
wanted to be a dentist since the age of 11.
Wow,
I
that's so young.
graduated with good grades from high school. I could have applied for anything.
Nice.
My aunts, uncles, they're all physicians, and they pushed me to go for medical school.
Okay.
But I wanted dentistry so bad. I told them, I like working with my hands. I want to be called a doctor. I want
I wanna
that
be a
prestige,
dentist,
but
yeah.
I
So
want to be a
early.
You
dentist.
want to be a
That's
dentist?
so early to be
Wait,
so
wait, wait.
determined.
So you're saying some people are pushing you towards being a
Physi-
medical doctor?
Physician.
Because what? It's supposedly a more
It's a
prestigious.
It's a
is
more
it?
prestigious
Right?
job, yeah.
I mean,
But at the same time, you know what? I love what I do. I wake up every day, going to work happy.
That's
even
the most
on
important.
even truly on vacation when I
Nice.
go to, like, I choose my vacations based on mission trips, medical mission trips.
oh wow.
So if I go to Lebanon, I go for 5 days in Lebanon for a medical mission.
Medical mission.
Where I treat children and special needs that need free dental care. And after that, I take 2 days to enjoy myself.
That's-
And I do
that's
that
sweet.
anywhere I go. If I go to India, I do the same thing. If I go to Kurdistan, I do the same thing.
I love how you're selecting the countries you go to, but the
That's
question
what
is
I
like,
mean.
how did it start with you that you made a decision that I'm gonna now approach my life and take my life in a way that's so selfless? You're giving so much of yourself to people, onto the kids or the special needs. Like, such a specific direction.
I had in dental school and residency, I had good mentors that were doing the same thing.
Oh, okay, okay.
I get influenced by good people.
Okay.
You know, I met good people throughout my life, got influenced by them, and they pushed me to do good things.
You know, Ahmed, as we say, every episode has a quote, and you know, they say, "Show me your friends, I'll show you your future." Right?
Oh wow.
So that's that. I think
You're full of those, aren't you?
But they weren't my friends; they were my mentors.
Yeah.
But
Show
it's
me
the
your
same
mentors,
thing.
I'll
It's
show
the
you
same
your
thing. Actually, one of my mentors, Dr. Bernat, you know, he's an older gentleman. He was the program director in Buffalo. I
Nice.
used to bike with him. I used to go ride motorcycle, and we go to the country road for breakfast on weekends. And he influenced my life. He influenced me to go to be better at what I do, special needs and pediatric dentistry. And at the same time, he pushed me to go for these mission trips and philanthropy work.
What made you choose this specific specialty though? Special
So-
needs and kids.
Going back when I finished dental school in 2007 from University of Pittsburgh, I came back to Kuwait. I did 1 year rotation as all medical
Right,
specialties
right.
have to do.
Absolutely.
So during that year rotation, I worked on few special need patients, and I found it difficult. It was challenging for me to do that. So I decided, you know what, I want to improve myself in that specialty. So I started seeing more pediatric or kids and special need patients.
And then
And
slowly
the more
just
I
took
go,
you with it.
Slowly took me there that I wanted to do
Nice.
specialty and
Nice.
residency in that.
But doctor, it must have been a very challenging journey.
It's a long journey.
It's
So
a long, yeah, 100%.
when people think of dentistry in the Middle East, they think of 5-year dental school,
Yeah.
2-3 years residency. Where we
It's
did
a
it in the
lengthy
States,
process.
it's much longer than that. So
the
it's
States it's longer,
8
yeah.
years to finish to be a
It
dentist,
takes a lot of
3
time.
years for residency, then about a year and a half to do a fellowship that specializes
Yeah.
in facial deformities and special needs. So it took me about 13 to 14 years, almost 14 years, to become or to finish all the degrees or finish all the
Wow.
education
That's
that
I can't even
get.
wrap my head around a 5-year degree, which I did, but you know,
But
all that time you spend, what keeps you going? What's the driving force?
the more I go, the more I learn, the more
Right.
I
You have a
polish my
passion for
skills.
learning. I
So
like that.
I have that passion. I have that passion
Nice.
to learn.
Learn.
And up to this date, we go to conferences to learn. So
Right.
as a physician, as a dentist, if you stop going to conferences, if you stop reading,
Right, you-
that's the day that you will not be able to work to your
Continuous
full potential.
improvement.
Yes.
Continuous
You have to
improvement.
continue- yeah.
All the time learning is kind of. But I think we have to clarify, because when you say special needs, can we clarify what special needs means in
So
this case?
special needs, it becomes from mental disabilities to physical disabilities.
Okay, okay.
So it's a full spectrum. So also special need can include patients with medical health risk, like cardiac patients. So you get sometimes pediatric and adult with severe cardiac cases. We treat them as special needs. Autism special needs.
Yes,
Down syndrome
being on the
is special-
spectrum.
Being on the
Wow.
spectrum is
Yes,
special needs.
and it's a very wide spectrum as well.
So it's a
It
very
is.
wide spectrum, and medically compromised patients also included.
Wow.
In that.
Imagine being in that spot where you're kind of like treating someone with such a case and how much effort it takes
It
dealing
takes,
with
it
it.
takes a lot of time to do your homework before treating, especially like if we get children. So basically, the ones on the spectrum, Down syndrome with mental disabilities, I treat them till later, till the age of 50, 60, it doesn't matter.
Doesn't matter.
If they have medically compromised, so if they have heart condition, I treat them till the age of 18. Then after that, I shift them to another dentist that understand and
Right.
can treat adults with special circumstances or special medical history.
Medical history. From your perspective, with your experience over the years, how long have you been?
So I've been a dentist since 2007, about 15
So that's
years.
15 years.
Yeah.
My question is, do you think the majority of people are taking care of their oral hygiene properly or not?
So unfortunately in Kuwait, it's not the case.
It's not the case.
It's not the case. in
Interesting.
Kuwait. Unfortunately.
What do you attribute that
A
to?
lot of people go to the dentist when they're in pain.
In pain.
And unfortunately, some dentists promote that. You know, when you're in pain, that means you have a lot of things that are going
Right.
wrong.
Right.
That means
Absolutely.
you'll pay a lot of
Yeah,
money
yeah,
to
yeah.
treat your teeth.
Right.
Or you might lose your teeth. But if you go on regular basis,
Recommended
biannually,
is like 6 months.
6 months.
Biannually.
And if you're a smoker, every 4 months.
Really?
If you're diabetic, every 4 months.
There you go.
So that sums up 80% of Kuwait populations. They should go every 4 months, you know?
Quite simply said,
Okay. And speaking in this same narrative, is flossing as important as they make it seem?
Yes, it is.
Yes,
Oh,
it is.
can I-
Yeah, absolutely.
I have an analogy, but I cannot say it on.
Okay.
on
Doctor, the
TV,
thing is,
but-
I'm not a doctor to say this, but
Okay.
I think I keep promoting flossing.
Yes.
My doctor once gave me a very simple advice. He's like, listen, Hussein, please floss. I bought a floss. My life changed.
Changed after.
The best thing I've ever done. It's better than brushing your teeth. I'll be honest.
Yeah.
It cleans everything. There's
Cleans
a lot
everything. You
of
need- yeah, it's
food, a
between-
lot of things that get stuck between
Get
your
stuck,
teeth
yeah.
that you need to clean them. So flossing, brushing, and also using a tongue cleaner.
Tongue cleaner.
Tongue cleaners
That's where
are
the bad
important.
breath comes from, wouldn't you say?
80% of it.
80%.
Yeah, 70 to 80%
So we
of
need a
bad
separate
breath. You need
brusher
a
for that.
Brush, or you can use your toothbrush,
Yeah,
but I
yeah,
use a
yeah.
tongue blade. It's
Tongue,
called
yeah,
a tongue
yeah,
cleaner.
yeah.
I use it to clean my
That's what
tongue,
we
brush
need.
my teeth,
Yeah.
floss, and I use a water floss.
Water floss is
Oh,
another
yeah, the one
thing.
they
Yeah,
spray
that's
there,
another
I spray
thing.
water between
Yeah,
my teeth.
do you also recommend that since you
love
use it?
I
Yeah.
love it. It's not a replacement of your regular flossing,
okay.
but it can help a lot.
Can help a lot.
I actually have a question. So, as a doctor that recommends people to come to them
Mm.
for checkups every 6 months, does a dentist go for checkups every 6 months?
And do you have to see yourself or another dentist?
It's like the barber.
That's
it's
the
like,
barber question. Do you cut your own hair?
Who cuts your hair?
So-
Someone else got it. So, truthfully, last time I had a cleaning was about 9 months ago.
Wait.
Yeah,
He
and
said every 6 months.
Every 6 I say that. But remember, I'm from Kuwait.
Dr.
included in
Youseef,
that
Dr. Youseef
population.
Dr. Youseef uses 10 times more products than we use. So
Okay, so he can do 9 months.
Yeah, he can afford to use.
Well, let's hear him out. Let's hear you out. Why haven't you done it in every 6 months?
So I didn't have time.
Didn't have time.
Yeah.
Okay.
Although I work with a lot of dentists on daily basis. I work
Okay.
with 11 to 12 dentists in the same clinic. I didn't have time. And I wanted to do it today before coming to this.
Can you do it for yourself with the equipment you have or no?
No, it's almost impossible.
It's like
no.
no.
It's
You're not gonna hold a
We
mirror.
just had to get the answer, you know?
some people on social media they show you how they
Right.
extract or take their tooth out.
Oh,
you
wow.
know? And it's not that easy to take your own tooth out.
Yeah,
no,
imagine. Yeah.
Imagine you're looking at a mirror, you're looking at another mirror, and taking your tooth out. It's not that easy.
It's not
Doctor,
that
I
easy.
have a question. So if I was to visit you, you're a very friendly doctor, and I would love to go to your clinic. However, a lot of kids go to the clinics and they're really scared from the doctor.
Fear.
What makes you as a doctor liked by the kids? What's your technique?
So I have many things. We, as a special need pediatric doctor, we work in many methods. So
Yeah.
young children that cannot tolerate long appointments or many procedures to be done
Right.
on them on the chair,
Yeah.
that hates the injection or had bad experiences. So I have patients that come into the clinic crying from the elevator to the dental chair. Okay, and at the age of 5, 6,
Yeah, it's
these
scary
patients,
for them, you know? Some certain
yeah,
kids.
these patients need special care and extra
care,
care. They
yeah.
need either laughing gas or they need to, you know,
Yeah, that's
they,
the one.
They
Yes.
need to go to general anesthesia to
laughing
sleep
gas.
to treat their teeth.
The laughing gas.
Yes.
Since you brought it up, what is it that's making us laugh?
It's basically makes you feel, it makes your head feel light. In
Light.
other terms,
Yes.
yeah.
Yeah.
But it's a good feeling.
It's the good stuff
yeah,
you guys have.
it's a good stuff.
Do you know how to, of course you've done it for
Yes.
a patient, right? Do you need to be specialized in that? Or
You don't need to be specialized according to the laws in Kuwait.
the laws in Kuwait? But
Yeah.
I think in the States you need someone who's a specialist?
No. Anyone can use it with a training for it.
Okay.
So you can
training.
have a special training for using laughing gas on your patients.
And what's the medical term for it? The laughing gas. We call it.
Nitrous oxide.
All right, that's it.
Amazing. Honestly, I think, Doctor, there's definitely a lot to learn from you. We're just going to go for a little break, and we'll be back to learn even way more and more untold stories.
And we're back on the Untold, continuing our conversation with Dr. Youseef AlAwadhi.
Hello, Allah.
Hello. So, Hussein,
Yeah, tell me.
so far
Yes.
we've learned about his inspirational story of how he became a doctor. How about we dive into more of your career? And I want to focus on those noble missions you go on.
Yes.
Tell me, how do you even arrange those? What happens? It's something beautiful to hear about.
So I started going on missions in 2009, and my first mission was to the Dominican Republic through New York University. The medical center, where they had missions going to Dominican Republic every 3 to 4 months. So I decided I want to go on these missions biannually, twice a year. So I bought my own ticket, went there, took a bag with dental equipment, and started treating children
Nice.
at orphanages.
Yeah.
So these missions are organized by faculty. They usually go 20 to 30 dental students and few dentists. I was
Few
one of the
dentists, you're
few
one of the
dentists
few
that go on
dentists.
these missions.
It's beautiful.
It's beautiful. You go on to these trips for this, again, as I said before, a selfless deed. It's a selfless cause. A lot of people don't believe in the existence of a selfless deed, like doing something for no personal
no
benefit.
personal, but there is a personal benefit.
Exactly.
Truthfully, like the peace
Satisfaction.
of satisfaction,
Yeah.
peace of
Yeah.
mind. The
Can't
feeling,
even imagine that feeling.
the feeling is great after each mission.
And you mentioned you go to countries like Jordan, Lebanon. I think it's the countries that need it the most. They
Needed
need
the
support
most.
more
Yeah,
the most.
Africa.
Yes.
You've been to Africa as well.
I've been to Africa. I've been to Liberia through World Health Organization.
Oh, nice.
So they contacted us. They said, "You do a lot of missions in this region. you treat a lot of kids. So on each mission, we treat about 2,500 kids.
Wow.
And
In the
we're-
time span of
In a time span of 5 to 6 days.
wow.
So we're a big team,
That's
by the
not-
way.
That must be a huge team.
It's a huge team. It's
Yeah.
about 20 dentists, 20 also specialists. So about 40 dentists in
Still,
total.
you're dealing with
and
2,500 in 5 days.
we're working like machines.
Around the clock.
Yeah, around the
Yeah, we
clock.
start at 7 a.m. We're at the mission site at 8.
Wow.
We work till 5. After 5, we go back to the hotel and go for a nice dinner.
Still
Wow.
8 to 5 is still, you know.
I mean, what is it like? I mean, if we can go back in time to look at these trips, right?
Yes.
What is there a trip that kind of like sparks something that you found very interesting that taught you a lot? Is it the first trip or is it something on? I don't know.
So
across
all the
journey?
trips, on each trip you learn something. On
Yeah.
each trip you meet amazing people. On each trip you meet people that they've done more than you've done and they inspire you. So on each trip I meet a doctor, or I meet a patient, or I meet someone that is not making his days enough money, or they're not making enough money for their day, but at the same time they're donating their time for the missions.
Wow.
So you see,
Yeah.
you see, like
Time
if
is
we go
money
to
after.
Lebanon, if we go to Jordan,
Yeah.
you see refugees donating their time for these missions to help us out organize. So
Right.
we go on these missions. We have a lot of equipment. We need someone to carry the equipment with us, to help us clean the equipment, to help us organize the lines, to register the people, because we have to keep full registration of every patient we treat. So these people are helping us, that help us out. They're refugees. They need more help than we can give them, but at the same time, they're donating their time and money for this cause.
Wow. I love that. It's like it's such a. I love seeing people that do things for no specific.
There's no financial
Financial-
gain,
financial
but,
gain,
but,
but-
it's something that
It's
fulfills
something in
you
them, and-
from the inside. you
And
know?
even though they're so like, even though you might travel and find them in such an unfortunate situation, these people, they're still there. They're still trying to support. And here you are, a doctor like yourself and the team with you, going in and telling them that, hey, listen, we don't want anything from you, nothing. We just want to support you. It's rare to see that nowadays.
So I think that good is the base of humanity.
Yes.
right.
Anything bad is acquired from your atmosphere and
Absolutely.
environment.
Absolutely.
So we start good,
Yeah.
then we become bad.
Then we become
Slowly.
The more you give, the more you
Life,
get.
my friend, you know.
It's like the more you give, the more you get, I
Yeah,
think. And
yeah,
I'm
yeah,
sure
yeah.
you've seen that. It reciprocates.
It is.
Yeah.
It is. After each trip, I come back. I'm happy. I'm a same person that I am, but I'm much happier. I'm much more relaxed. I'm more blessed, and things happen.
100%.
Better things happen to me after each trip, and I've done so many. Like I've
Yeah,
done-
and I love that you've done.
I do
so
like
many.
4 to 5 a year.
Wow.
Yeah.
We
So
have to like.
you have to come
Thank
with me
you
to
for
one.
this, of
Well, you have
course,
to
you
come.
know.
Honestly, thank
you
you so
guys
much,
have to
yeah.
come to see these trips. So, and
We
some
can
of
come as like what
volunteers-
role are we serving? Them?
volunteers.
Okay, that
Yeah,
sounds
you
like
can
a
come
plan.
in and we'll make you carry equipment, wash equipment, register people.
I think it's an
Register
experience.
people.
It's an experience. It might spark something in
yeah,
you that
it
kind of
might.
like takes you on that journey of
And
the
volunteering
selfless
is
deeds.
a lot of fun, honestly.
Yes, and
It is.
In a
is.
lot of fields, volunteering is fulfilling.
yes,
It is. It
You
is.
know?
On our next trip in May 20th to the 26th, we're going to Lebanon. We have
Saying you gotta go with that.
we have 20 dental students volunteers
you.
that are coming, plus 10 non-medical volunteers that are coming. Yeah, plus the dentist that we usually go to come with us to these missions.
Doctor, if we can dig deeper into some of the locations, so if we can talk about, because I know a lot of locations face certain diseases that could be widespread across them, and I'm sure it could be very challenging and different across regions. So if we can dig deeper into certain regions that you went to, that you found very interesting and very different as to what diseases they had.
Liberia.
Okay.
Now in Middle East, our diseases are very similar. If you go to Lebanon, if you go to Jordan,
Yeah.
we're the same community, we're the same people.
What's
we have,
common? Cavities and stuff?
Well, cavities are common,
yeah.
heart diseases are common, blood diseases are common. So things are common around
Right,
this.
right.
But we don't have malaria in the Middle East.
Exactly, that's one difference.
We
Yeah,
don't
yeah.
have typhoid in the Middle East. Okay, so when I was planning to go to Liberia, I get this list of all the immunization that I have to get. So
Is that a long list?
it's a longest list.
get all
the shots?
Longest. I got a
You have
lot
to
of
take all
shots
the
before going
shots.
to Liberia. And going to Liberia, then they talk about the history. Unfortunately, they had few diseases that became a pandemic there, such as typhoid and cholera. They had malaria.
Oh my God, so they've had very big ones.
They had, very big ones. So I had to take malaria medicine every day as a precaution to protect myself from malaria.
Wow.
So that's one of the trips that if I have to repeat, I will repeat. But taking all these medications, I don't know about that.
But there you go. I think you're here now. I mean, I think you went through it. You learned from it.
Yeah.
But is there anything like dental-specific diseases that you?
Dental-specific diseases, caries. Caries is the most common
What is
worldwide. Decay.
Tooth decay.
Tooth decay. Tooth caries. So World Health Organization, I think, ranks tooth decay first or second most common disease in the world. Of course, each country is different, but
what causes tooth decay?
Tooth decay is so basically three components, the major components that cause tooth decay: bacteria, sugar, and food accumulation on your tooth, not brushing. So if you do these three, you're not brushing, you have food, you have bacteria, your tooth will start dissolving from the bacteria.
Even malnutrition would contribute.
Malnutrition can cause gum diseases, bleeding, can cause your bone to break down and lose your teeth because of malnutrition. But tooth decay is not usually caused by malnutrition. So one strange thing that happened to us in Liberia, we did not find many tooth caries or tooth decay in Liberia. But what we found is a lot of bone diseases.
Okay.
In the jaw.
And that's because of malnutrition?
Malnutrition is part of it. Okay. Another part is if they get one tooth decayed and they don't get it treated, and the infection become recurrent over years, so they start having bone diseases.
I see.
Before I want to go to my next question, I want to shout out everyone on your team for going on these trips.
Of course.
Helping people, that takes a lot. So thank you from the bottom of my heart. That's awesome.
I really appreciate it. I think they all will appreciate it. And I'll even send them the episode once it comes out.
No, they have to see it. I think definitely it's a big topic that everyone has to watch.
I want to now step into the future of dentistry.
Yes.
Are there any technological advancements that are newsworthy that you can share with us about specifically dentistry?
Okay. So dentistry from 1990s up to now moved a lot, especially in cosmetic dentistry. Now in pediatric dentistry, it hasn't changed a lot, but in the last 5 years, remember the silver crowns that they put on baby teeth after fixing them? These are not silver fillings, these are silver crowns. Now recently, a company in the States and a company in India made up this new product that replaces the silver crowns with white crowns.
Naturally looking.
They're not really supernatural, but they're much better aesthetics. So that's when it comes to pediatric dentistry. Fluoride came out about 20 years ago, and fluoride varnish and high content fluoride helped in reducing caries rate a lot. Now when it comes to cosmetics, advancements, a lot of changes happened.
Yes, exactly.
Natural teeth, labs, they established machines. They have machines now that make teeth instead of lab technicians with really precise measurements.
It's the AI. It's like the AI of dentistry.
That's what I was going to ask. Are robots being trained as dentists to do any part of surgery or any part of cleaning maybe?
Now there is advancement like that, but it's not yet.
Okay, because we've seen robots do different medical surgeries.
Yes.
Haven't seen them in dentistry yet.
Not in dentistry yet, but it could happen in the future. We see a lot of advertisement for it. So it could be a robot that is controlled by a dentist, remotely on a computer.
Or a computer.
So that could happen.
It's crazy.
Yeah,
it's crazy.
What we see now is microscopes. So dentists are working under microscopes. So they're seeing the tooth bigger. They're getting more precise with
that's always good.
0.0 millimeters with using a microscope, especially with root canals and aesthetic dentistry.
Doctor, if we can just kind of like share with people, I think it would be very interesting to share a story that you've had. So going back into these trips that you've had and throughout everything that you've learned, is there one story that you kind of like stands out that you feel people would want to hear and would learn something from?
Well, many stories, but one story that I think of is we were at Beit al-Yatim al-Durzi in Lebanon. It's an orphanage for kids in northern Lebanon, I think. We were there a few times before, but this time we had a doctor with us from Kuwait, and we started taking pictures. The doctor had a call from his sibling in Kuwait, his sister, and she told him, you know, talk to the orphanage. I want to adopt this kid that you took a picture with. And I'm like, yani, we were here treating kids, and you fell in love with that kid because of a picture.
That's big.
You know what I
And
mean? And you
That's
never
very nice.
seen
contributed
that
into
kid.
helping
And
that
she
child
wanted
get
to adopt
adopted.
a child
Yeah.
That's very nice.
based on a picture that she saw on social
You
media.
never know what hits.
Honestly,
you never
You know, and I was like, you saw many kids
So
that we
why-
posted.
why
This
this kid?
specific child? She's like, I don't know.
She saw something.
Just something.
Just
connected.
something about that child that
like
I
that.
want to be responsible for.
Wow.
So I think she took care of the child. I don't think she adopted the child, but she
Financially took care of
take
him.
care of the child
Nice.
in the orphanages up to this date. And that happened maybe about 3-4 years
It's a
ago.
beautiful story.
Just shows you how much if you put something out of your heart, how you can get so much in return.
And
Such a
people
small
ask us, like,
satisfaction.
I don't do a lot of social media with my trips. I don't post a lot, but my colleagues, they post, and it's important to post. We need to show people what we do.
Yeah.
We need to show people that you can do something also. You can come and do something.
course.
It doesn't matter how small it is, it helps.
Yeah. Before we wrap up, though, I want you to maybe share a message with our viewers or an advice from your experience.
So I tell my children all the time, I have 2 kids, they're young, they're 6 and 5 years of age. And I tell them, work hard. Anything you want to do in life, work hard for it, it will happen. Doesn't matter what it is, it will
It's
happen.
very true.
Yes, exactly. And I have a mission.
Yes.
And
absolutely.
I like that voice too.
Yeah.
It's a very deep voice.
And that was like a movie trailer.
I tried. Thank you for joining us today for the Untold and sharing your story with us.
Thank
it
you
was
so
a
much.
beautiful conversation. Thank you so much for your time.
Thank you very much. I'm really glad to be here. Thank
It's
you.
a pleasure.
Ladies and gentlemen, we'll be right back with the wrap up.
We're back with the last segment. Ahmed, I think. What do you think, first of all? I want to ask you, Kareem.
A lot of things to process, honestly. He said a lot of interesting things, especially his noble missions, the volunteering,
Yes.
the teams, the different countries they visited, you know.
Very selfless person,
And
honestly.
it's just, he's quite the character.
You know what I took from him? He said something around the lines that people usually wait for crisis to take action. Like we wait for pain to go to the dentist.
And
Perhaps,
that's never the way to do it.
yeah,
you know.
I think just
Go see your dentist twice a year, not twice a month. That's excessive.
Exactly,
Twice
exactly.
a year, you know, and just take care of your
Absolutely.
oral hygiene as well as your usually people take care of their well-being, but they
Exactly.
forget their
Exactly.
oral hygiene.
I think we can learn that the more you give, the more you take. This doctor has done tremendous things for a selfless deed. I think there's a lot to learn.
Yes.
This is the final wrap up for this episode.
Yeah.
We cannot wait to see you in the next episode with yet another Untold story and more guests. See you later.
Good night.